Thank you for taking time on this Saturday to come to this discussion of public health care in Canada and the US, a matter of justice. My name is Barry Eidlin. I'll be the moderator for today's discussion. I am a member of the Los Angeles chapter of Democratic Socialists of America and also an assistant professor of sociology at McGill University, which is in Montreal, and that's a long story of how that works, but I'll save it for another day. My research focuses on working class power and politics in the US and Canada, and you can find my writing in Jacobin, the Washington Post, other venues. There's a book if you want to know more. So like I said, the discussion is focused on the theme of public health care in Canada and the US, a matter of justice. If that's not the webinar you signed up for, there's the exit button toward the bottom right corner of your screen. For the rest of you, we've got an exciting panel today. So we're going to be talking about the fight for healthcare for all across borders in the US and Canada. Everyone on this call is probably far too familiar with the horrors of the US private healthcare non-system. We've all heard the statistics. About 45% of Americans, even with Obamacare, remain uninsured or underinsured. The US spends about twice as much per capita on healthcare than other wealthy countries, but has worse healthcare outcomes. So the US is close to last when it comes to infant mortality. It has the lowest life expectancy amongst other comparable countries. And the COVID pandemic, of course, has only exaggerated these problems and inequities, which of course fall hardest on the working class and communities of color. But beyond the horrors of not having insurance, we can also add to that the horrors and daily indignities of having private insurance in the US system. The constant hassles of managing copays, co-insurance, whatever that is, in-network versus out-of-network providers means that many Americans avoid getting the care they need. And of course, it doesn't have to be that way, as nearly every other industrialized country in the world shows us. So Canada, like most other countries besides the US, manages to provide healthcare to all who live there for literally half the per capita cost of the US system, so $5,500 versus $11,000. And unsurprisingly, Canada has better overall health outcomes than the US across a variety of metrics. But as I often have to remind US audiences when I talk about comparing the US and Canada, it's important to recognize that there are real problems with the healthcare system in Canada as well, and that Canada is not some sort of social democratic paradise that we can look towards with rose-tinted glasses. Those problems with the healthcare system do not relate to a lack of private options, as some on the right try to claim. Rather, it's that Canada's system still doesn't go nearly far enough towards guaranteeing care for all aspects of people's health. Right? There still isn't universal prescription drug coverage, dental, vision, hearing coverage, a lot of mental health coverage. There's still gaps. And of course, we can't talk about healthcare in Canada without addressing the profound crisis in long-term and elder care, which the pandemic has highlighted in particularly gruesome fashion. So even though the immediate tasks might be different in the US and Canada in terms of the fight for healthcare for all, the overall goal is the same, namely a healthcare system that works for all of us. So here to discuss the urgent problem today is a panel of people who have been deeply involved in this fight for many years. So we've got Don Davies, who's a member of Parliament for Vancouver Kingsway, and he's been elected and re-elected 4 times now. He's worked before joining Parliament as a lawyer, labor representative, policy advisor, and he serves on the House of Commons Standing Committee on Health and played a key role in the committee's study of national pharmacare, so prescription drug coverage. And so he's a passionate advocate for comprehensive public health care, driving the agenda for universal access to dental, mental health, and hearing vision care. Then we have another member of parliament, a member of the, both Don and Peter are members of the New Democratic Party, Canada's Labour Party, for those of you who don't know. Member of Parliament Peter Julian was first elected as a member of Parliament for Burnaby, New Westminster in 2004, and for the past 16 years has been a strong advocate and voice in Ottawa, which is the capital of Canada for the Americans here who might not know, for the constituents of his riding. And prior to his election, he worked as a financial administrator and a former executive director of the Western Institute for Deaf and Hard of Hearing. He was a founding member of the Council of Canadians and rose to become the National Executive Director of the Council, which is Canada's largest citizens organization, and is currently the NDP House Leader and Finance Critic. Then we have Linda Silas, who is the president of the Canadian Federation of Nurses Unions. And she is a 5-foot feminist dynamo with a soft heart and strong stomach, passionate about making a difference in people's lives. She started off as a nurse working in the ICU, emergency labor and delivery departments. She started quickly her tenure as a full-time labor activist as a single mom of a 13-month-old son, rose through the ranks to become president of the New Brunswick Nurses Union, where she served for 10 years, and has been president of the 200,000 member Canadian Federation of Nurses Unions since 2003. We also hope to have with us New York State Senator Jabari Brisport. I'm not quite sure where he is right now, but hopefully he will be joining us soon, and I will introduce him then. For now, here's how the sessions are going to work. Each panelist is going to make a brief round of opening remarks, and then I've got a series of questions for the panelists. If you have a question you would like to ask the panelists, I would encourage you to use the Q&A function in Zoom. There's that the Q&A, the dialogue box. There, I already see 2 of them in the bottom of your screen. And I will call on you. I will not call you. I will ask your question. And then we'll have some closing remarks, and we'll wrap things up with a call to action with some concrete steps that you can take to build the fight for healthcare for all, whether you're in the US or Canada. So first up, I've got Don Davies. So Don, why don't you take it away for now?
Well, thank you, everyone. It's a real pleasure to be with you today. I'm calling in from Vancouver, Canada, which is the unceded territory of the Coast Salish people, the Squamish, Musqueam, and Tsleil-Waututh, by whose grace we gather and work. So I'd like to make that land acknowledgement to begin. I'd like to thank the Democratic Socialists of the US for organizing this wonderful event. I think we need to do more cross-border solidarity work because, frankly, the issues that we're facing and that face working people are really the same no matter where I think we are in the world. I'm going to speak for 3 or 4 minutes. I've been asked to give you a brief history of how public health care came to be in Canada. So I'm going to try to channel Stephen Hawking and give you the briefest history I can here. As health critic for the New Democratic Party of Canada, I'm humbled by the knowledge that I stand on the shoulders of giants, and that those are the courageous women and men who fought relentlessly to establish universal health care in Canada over half a century ago. And among the most towering of these giants is the NDP's founding leader and father of Canadian Medicare, Tommy Douglas. Now, for my American sisters and brothers, Tommy Douglas led a party called the Cooperative Commonwealth Federation, which was the predecessor to the New Democratic Party, which was formed in 1960. And that is the Progressive Party in Canada. It's not the Liberal Party. It's the NDP in Canada that represents the left side of the spectrum in this country. Now, Tommy was first elected Premier of Saskatchewan, one of Canada's 10 provinces, through a landslide victory in 1944. And his party, the Cooperative Commonwealth Federation, which again, it merged with the Canadian Labour Congress in 1960 to form the NDP. They formed the first democratic socialist government in North American history, running on the slogan, humanity first. And despite inheriting a crushing public debt from their Liberal predecessors, the CCF was able to make immediate strides towards universal healthcare in Saskatchewan by implementing a province-wide public hospital insurance plan in 1947. Note that this covered every resident for hospitals only, but it established the fundamental concept of universal public coverage. So imagine every resident of Canada could walk into any hospital in the province of Saskatchewan and get immediate care with no cost to them. But Tommy and his colleagues, they kept working. More importantly, the program was extremely successful and wildly popular. By 1961, the CCF government was able to establish Medicare for all by passing the Saskatchewan Medical Care Insurance Act. And what this did is this added physician care to the public Medicare model. Now, interestingly, by that time, the opponents started to organize, and supporters of the legislation faced an immediate onslaught of disinformation launched by doctors, business groups, and nearly all the media outlets in the province. I don't know if my American sisters and brothers find that familiar. Behind the scenes, the Canadian and American medical associations were leveraging their substantial resources to defeat any prospect of a single-payer healthcare system advancing. And they employed the same propagandists and tactics used to thwart healthcare reform in the United States under the Truman and Kennedy administrations. But on July 1, 1962, when the act came into force in Saskatchewan, most physicians in Saskatchewan suspended practice in protest. They went on strike. Now, and an illegal strike, by the way. Now, the province fought back and they refused to give in. They responded by bringing in doctors from Britain and encouraging others in Canada to come to Saskatchewan from the US as well and other parts of Canada. And local citizen groups also mobilized by organizing medical clinics, and they hired doctors to attend them. The impasse lasted 23 days. By July 23rd, 1962, the doctor strike had collapsed, and from that moment, Saskatchewan's Medicare system became a model for the rest of Canada. Now, recognizing the power of that successful and popular model, the Progressive Conservative, for my American sisters and brothers, that's the Republican Party in our country, the Conservative Prime Minister John Diefenbaker appointed a fellow Conservative, Justice Emmett Hall, who was a judge, to chair the Royal Commission on Health Services in 1961. And that commission was intended to examine all aspects of Canadian healthcare, but its hearings overlapped with the Medicare debate raging in Saskatchewan. In 1964, the Hall Commission released its report, and it shocked the country because it recommended the adoption of a comprehensive health insurance program based on Tommy Douglas's Saskatchewan model for the entire country. And I want to stop there and emphasize, ever since that day, every single task force, committee, study, royal commission that has ever looked at how most efficiently and best to deliver healthcare in Canada always comes to the same conclusion, whether they're from the right or the left, because the evidence is overwhelming that it's the cheapest, best way to deliver healthcare. Now, in response to that report, some provincial premiers, they alleged that this approach was an intrusion into their provincial jurisdiction, and there was a reluctance to proceed within then Prime Minister Lester B. Pearson's Liberal caucus. So by then, Canada had a Liberal Prime Minister. Those are the centrists in Canada. However, because Canadians had elected a minority federal parliament in 1963, with the NDP holding the balance of power, under the leadership of Tommy Douglas, who by then had gone from the Premier of Saskatchewan to the first leader of Canada's NDP, the NDP was able to leverage our influence to advance the implementation of Medicare for all Canadians. Now, importantly for today's political climate, Tommy Douglas argued then for a comprehensive system covering all necessary medical services, including pharmacare, dental care, eye care, auditory needs, etc. And interestingly, dental care was recommended by the Hall Commission in the 60s. And the only reason that it wasn't included at that time, by the way, was because Canada had a shortage of dentists and we couldn't actually deliver service for every Canadian. So basically the Liberals, they were not willing to go that far. So due to NDP and public pressure in 1966, Parliament adopted the Medical Care Act by a vote of 177 to 2. So that legislation made access to physician and hospital care a right of citizenship across Canada rather than a privilege. So Canada's universal public healthcare system has since become a hallmark of Canada's identity. It's an institution, I think, that's cherished from coast to coast. It's an affirmation that we will take care of each other at our most vulnerable, and it's an enduring reflection of a commitment to equality and justice. But I want to end by just saying that our system is good, but it's far from comprehensive. Today's NDP, and I think my colleague Peter Julian will pick up on this, the NDP is carrying on the fight for an expansion of public coverage to include pharmacare, dental care, and mental health services and other services under the basket of services covered by our public system. For us, not only is this a question of social justice and fundamental human rights, but it's also, as Barry said, the most efficient way to deliver quality care. And research now makes it very clear that it also saves society money long-term by keeping citizens healthy and preventing more serious, costly intervention years later. Thanks very much for your questions. I look forward to the discussion.
Great. Thanks, Don. And next, that is a great segue to Peter's comments, where he's going to talk about where the fight for healthcare for all stands today. So Peter, your turn.
Thanks very much, Barry. And I'd like to thank the Democratic Socialists of America for sponsoring this forum. And it is vitally important that we have solidarity between Democratic Socialists in the United States and in Canada, and look forward to working together to move forward so that we have in place in the healthcare sector, for example, healthcare for all, pharmacare for all, and a real high level of healthcare right across North America. As my esteemed colleague, Don Davies, who is the most renowned parliamentarian when it comes to healthcare, has said that the background of Tommy Douglas bringing forward healthcare is something that Canadians cherish. First, Tommy Douglas was voted in a national competition just a few years ago, the status of the greatest Canadian in our history. Secondly, of course, our universal healthcare system is renowned as part of what is the most important of Canadian institutions. So public universal healthcare is something that Canadians feel very, very strongly about. Now, that being said, we need to expand from universal healthcare to other areas that are not covered. And this is where we come to a historic vote that was held just a few weeks ago, where parliamentarians for the first time were called to extend our universal public healthcare system to include pharmacare, medication for all. And in a very real sense, there's a parallel in the struggle for pharmacare in Canada and healthcare for all in the United States of America. What we saw in Canada is a pushback from the pharmaceutical industry, very similar to the pushback from the health insurance industry on Medicare for all in the United States. So we mobilized through the support of extraordinary national leaders like Linda Silas, that we hear about in just a moment, as president of the Canadian Federation of Nurses Unions, doctors across the country, nurses across the country, more than 100 cities, towns, and villages. The labor movement involving millions of Canadians all supported the vote in Parliament that took place just a month ago that would have brought in the Canada Pharmacare Act, in other words, pharmacare for all. The pharmaceutical industry pushed back, and Liberals and Conservatives, who are very much the right wing of politics in Canada, heeded the call of the pharmaceutical industry and voted against that important legislation. So that vote failed. But in the public mind, I think there is an overwhelming support for pharmacare for all. In fact, most polls show that over 80% of Canadians support the idea of extending our healthcare system now to include all medication. And so this is extraordinarily important. It means that we are making progress, and it means that cross-border cooperation is even more important. And I look forward to certainly to your questions, but would like to say in deep appreciation that I'm speaking to you from the traditional and unceded territories of the Kakite First Nation and the Coast Salish people. And thank you so much for your invitation today.
Great, thank you so much, Peter. And we will now move to our resident dynamo, I guess, Linda Silas. So please take it away to talk about the current fight for pharmacare and against the pandemic.
Thank you so much, Barry, and nice to meet you virtually. It'd be great to all be together. Looking forward to meeting the senator. His bio is quite impressive. I had to chuckle with the organizer earlier that he's 33 years old and my son is 31. So I felt ooh, but my son is also an amazing activist, and hopefully we all join one day. But I'm here in Ottawa, kind of a sleepy town because of COVID-19. Parliamentarian like Peter and Don are doing their work at the exterior back in Vancouver. But I'm on the unceded territory of the Algonquin Anishinaabe people. And proud to be here. Very proud to be on this panel. And I have to say, I'm here with two, not only colleagues, but partners in crimes. We do believe in our healthcare system. We are proud of our healthcare system. It's like one of these badge of honors that Canadians wear. And it's something, there's not one politician. Even the deep, deep, dark conservatives in our country would never dare put our public healthcare system on a ballot box because they would lose. Canadians support it. And as Peter said, Canadians also support expanding it. And we have to work better together to move on to this. I have to say, Barry, my first rally with the United States for Medicare for All was in 1995. In San Francisco, when we did a Medicare for All rally across the Golden Gate Bridge. And I've been there many, many times with my colleagues at the California Nurses Association and the National Nurses United, which have been big supporters of a Medicare for All in your country. And for many, many reasons. You can look at the economics and why we need it, but it's also as nurses, our role, our DNA is to take care of people. And it is for Canadian nurses, we can't even imagine waiting to see if you have a credit card or if you have an insurance card before giving you the care you need. So that's why we have been able to join force with CNA and NNU for many, many years, because we believe that healthcare, it's like education, it's like housing, it's a human right. And when you need it, it needs to be there. So it's quite important for us to move on. So as much as we're proud of our country, you heard from Don and Peter, we need to expand it. And COVID-19, the whole pandemic has really expanded our eyes on how we need to expand our healthcare system. It doesn't make sense that our healthcare system stops at the door of a hospital, which only covers doctors, which only covers. So when you're in the hospitals, so in Canada, you get into a car accident, you need intensive care, you need chemotherapy, etc. As long as you're in that building, you're covered 100%. You never have. You can see the best specialists across Canada and they're all working together. But as soon as you walk out of that hospital, you're on your own. And that we have to fix. Because as nurses, we see the revolving door coming back. We see physicians, nurse practitioners having to keep patients in the hospitals just for them to get their prescription drugs. Or if they're lucky enough, they give them samples. We're a very rich country. We cannot have a system that works on giving samples to patients when they need them. So we have to fix that. Peter mentioned to you the 80% plus Canadians that are ready to expand it. We've been very, very close very often for prescription drugs. And we honestly thought after the last federal election, politics are politics, all due respect to my two politicians and soon to be three with the senator here, but politics being politics, we have a minority government. Pharmacare was a priority with the NDP, was a priority with the Liberal Party, was a priority with the Green Party. So we were we were very hopeful. And then the pandemic hit. Well, what the pandemic showed the rest of Canada is when there's a crisis, the federal government can open up the bank, can find money. And we were able to help Canadians as we never thought we could help Canadians. Now we need to make sure that not only in pharmacare, because Canadians are expecting more than prescription drugs now. They want long-term care, the disastrous, the unthinkable working conditions and the debts and the living conditions that our seniors in our country lived on during the COVID-19 is unbelievable. So you have pharmacare, you have long-term care, and you have mental health that will become priorities as soon as we have the next federal election for sure, and governments will have to look at it. So we've done research after research on pharmacare. We've shown the politicians that not only it's efficient, that we will be saving money, we'll be better treating patients, and they'll be more productive in society because they'll go back to work. But you're talking billions of dollars. So, some studies go from $1 billion to $11 billion we'd save. So you're thinking, okay, for the US, that's 10 times that amount. So we really have to work. So you heard both Don and Peter say how it was a big push, even in 1964, 66, big push, still a big push. Nurses work with every party and to make sure with every group. And right now we're working with the Canadian Labour Congress, which is the AFL-CIO in the US, and the Heart and Stroke Foundation, because we have to build our coalition. That's what you're doing today, is building that coalition. And it's the only way we're going to change the world and make it better is if we're all pushing in the same directions. And sometimes it's pushing politicians in different ways. And we're here to do that. So I'll look forward to your questions and happy to be here.
Great. Thanks so much, Linda, for those comments, and also to Peter and Don. Just a programming note: we have been in touch with Senator Brisport. There was a scheduling error in his office. He is going to be joining the call very shortly, and we will sort of loop him back in and allow him to make some comments when he does join. For now, though, we do have some questions that I'd like to pose to the panel. And one other programming note, which is that for our Americans in the audience, that Tommy Douglas may be known in Canada as the most beloved Canadian of history, but he's generally known in the U.S. as the grandfather of Kiefer Sutherland. So that might be a sort of an important point to mention. So let's move to some questions here, and I guess one is a general question that I can open up to all of you, which is to talk about, and we've talked about sort of what the current challenges are, but I'd like to hear more about what the obstacles we face, right, in terms of expanding healthcare, right? So in terms of, where are the blockage points that we need to confront? Obviously, public opinion is not one of them. We have massive support for expanding, but what's preventing the expansion? Where do we need to focus our energy?
Well, I'll jump in first. I know Don and Linda will want to add. It's a no-brainer in so many senses. When we talk about expanding pharmacare, the parliamentary budgetary officer who determines what the overall expenditure and overall benefits are of all programs. It's an independent officer of Parliament. And him and his office determined that Canadians as a whole would save billions of dollars by moving to that pharmacare for all model. Like the US with healthcare, we spend an inordinate amount of money on the for-profit sector. And so we actually save money. And so this is a major advantage, both for universal healthcare, but also for universal pharmacare. Now, where does the pushback come? Well, the pushback comes from the lobbyists in the pharmaceutical industry who don't want anything to do with cutting their profits. And certainly when we talk about medication, countries like New Zealand that have moved to a universal pharmacare model have cut the costs for pharmaceuticals often by up to 90%. So the lobbyists push back because their profits will diminish. The benefits to the population are very well known. But interesting point, as the Wharton School of Business pointed out, analyzing the healthcare systems in both countries, when healthcare was brought in, there wasn't the pushback in Canada from the healthcare industry, from lobbyists, because it wasn't fully developed at that time. And we are seeing pushback on universal pharmacare because the lobbyist industry around the pharmaceutical industry now is very well developed. So it's an interesting parallel between the two countries, and it explains why we need to work closely together so that we get Medicare for all, pharmacare for all right across North America.
And if I can add, Barry, democracy can also be an obstacle. In my country, we have 13 provinces and territories with their own little kingdoms and queendoms with provincial premiers and territorial premiers, which you move the bar so far, they agree, and then we have a provincial or territorial election and you have to start back. And the federal government, for our national government, will often use it as an excuse. We can't get the province and territories all to agree. Well, honestly, we don't need them to all to agree. We need to have leadership federally, and then the province territories will opt in. Similar as what happened with Medicare. They didn't all join in the same day as the federal government passed the act, but we need that. So for us, the first time all the premiers agreed to a national pharmacare program was at their annual meeting in 2004. And we got them signed. They put it out in their press release. And it was like, wow, we're there. And then we had a federal election. And we hit deep, dark conservative for a few years. And it took a pause. Well, during that pause, what we did was a lot of research on the efficiency, on saying what big pharma was doing, which was enriching their pockets, and how the poor and the sick were getting sicker, and our hospital system was going into a spiral of extra costs because of this. And then we kind of got out of it. And the last two annual meetings of the Council of Federation also in their press release supporting a national pharmacare program. So that, again, that was all good. Well, since that 2 years, most of all our premiers have changed in our provinces, which are like your states. So we have to start over. So it's, again, there's big pharma, always there, and they have money. Like, they have money. Full page ads in any newspapers you want. And then there's our democratic process, which we cherish, but can be a challenge.
I will just, I think, maybe clarify, or Linda's right. I think that the problem is less to do with democracy per se, and more to do with federalism, which is a huge problem that Americans face as well. Although Canada actually is an interesting comparison, precisely because healthcare is actually a provincial matter. It's actually
no.
third.
Yeah, not to correct you. Well, the administration and the delivery is a provincial matter, but the program itself is federally. But we have to also realize, as Canadians, for those Canadians listening, we're in population-wise, we're about the size of California. So sorry, those Canadians that think they can do better on their own. We have to work together to make it work because we're not big enough in population. Sorry, Don, I took you part of your 2 minutes.
But it's an important point because federalism is often identified in the U.S. as one of the main obstacles to achieving a kind of Medicare for all. But then it also creates opportunities, like in California, where I am. There's currently an effort to create, a Medicare for all in California, right? Which, as Linda just rightly pointed out, is roughly the size of Canada population-wise. So anyway, so the question, the role that federalism plays is a critical one. Don, did you want to add something to the obstacles question, or should we move on to other questions?
Well, I'll just add one thing. I agree with everything that my fellow panelists said there. I think education is part of it as well, and frankly, circumstances. Like, quite honestly, it was it took a minority parliament in the 1960s with a unique makeup of time and place and circumstance to bring us healthcare. But in terms of education, I'll give you an example. When we were studying pharmacare at the Health Committee for 2 years, right now in Canada, about 20 to 25% of Canadians have no coverage for pharmaceuticals whatsoever. So the proposition is, well, how can we cover all those people and save money? I mean, it seems counterintuitive, doesn't it? But actually, when you break it down and you actually do the work on it, you realize, well, if you bulk buy pharmaceuticals for 40 million or 37 million Canadians, you save 40%. If you have streamlined administration, right now in Canada, there's over 100,000 separate extended healthcare plans processing pharmaceuticals in this country. If you replace that with a single payment plan of each province, as we do now for processing other covered services, you get enormous savings administratively. Cost-related non-adherence, which is a fancy word or phrase for saying that if you give someone their insulin today, then they don't get sick 2 years down the road and end up in intensive care. You save way more money by keeping people healthier. So the cost savings and the health economics of it are well established now, but I don't think it's well known among the population. So I think we have to educate people. My final point is, there's that phrase, don't ever waste a good crisis. I think the COVID crisis is tailor-made for the left. Usually crises are seized on by the right. The 9/11, it spurred a nation security kind of movement. The 2008 economic crisis, spurred financial and fiscal sort of reforms. This is the first health crisis. And so I think people have experienced two things. One is they've experienced how fragile and precarious employer-based benefits are. We had 2 million Canadians thrown out of work in this country who then lost their dental and pharmaceutical benefits if they had them at all. And by the way, I also want to speak to the millennials in our crowd here, that it used to be when I was, getting work in my 20s and 30s, it was automatic when you went to work for an employer that you had some sort of benefits program. Not so the case anymore with contract work, gig work, temporary work. People and employers, by the way, I wanted to just mention, out of the surprising testimony I heard at the Health Committee, maybe the most surprising was the degree of support for public pharmacare from the business community, because they know they want their employees to be covered and healthy. And the single fastest rising cost in the bundle of extended care benefits that are covered is pharmaceuticals. And they know they can't afford it. So they actually see the benefit of transferring that obligation onto the public system here in Canada. So I think we have to seize the moment. There's opportunity here, and we have to act right now, because I think the window will close. It can close in a matter of 6 months, 12 months, a year or two.
Sorry. Okay, great. So we're going to interrupt our Q&A because we have just been joined by it seems like a mobile State Senator Jabari Brisport. And I had an introduction prepared for him, but in the interest of time, I think I would just say that he is a longtime organizer. He has been fighting for a variety of social justice issues, including Medicare for all. And I think we've been hearing the Canadian perspective here, but I think it'd be good to have Jabari tell us a little bit about the fight for Medicare for all in the U.S. and where things stand with that. So, welcome, Senator Brisport, and let's hear what you have to say about the fight in the U.S.
Thank you so much, Barry, and thanks to the organizer. Sorry, I'm a little bit late. I got a little confused on the time zones. It's what happens when you have in these international events. But hi everybody. My name is Jabari Brisport. I'm a state senator in New York, from Brooklyn based, an open socialist. So single-payer healthcare is incredibly important to me, and I think I'll just start by preferencing with the fact that I think, if anything, COVID-19 really showed us what happens when you don't have a robust social safety net, specifically in response to healthcare. There's a lot of mistakes that were made on the part of the administration at the federal level, at the state level, in multiple states. But one of them, it has to be said, is that decades or really never in our country's history have we said healthcare is a human right, and we're going to make sure that we're investing in it to ensure that every single person, every single human being has access to it. So the need is there. There definitely is a change in the political calculus of what we're seeing now, and I can speak to New York specifically, and then the U.S. at large. Because there is the fight for Medicare for all at the national level, and in New York, we have our own state level version that we're fighting for, called the New York Health Act, which would guarantee single-payer healthcare to every single person in New York. And I'm glad, there's some of my Canadian friends are on this call, because I've often likened the fight in New York to Canada. I know that it started out with Saskatchewan bravely leading the way in single-payer healthcare and serving as a model for the rest of the country. And I told many of my colleagues, we could aspire to be the Saskatchewan of the United States. And I actually believe that fight was led by a socialist mayor too in Saskatchewan. So we're working on it. I believe this year is going to be the year to move on it. I can't imagine, if you can't pass single-payer healthcare in the midst of a pandemic, I don't know when else you can do it. And, I've spoken with the sponsor Senator Rivera in New York, and we're feeling very confident about moving it. We have the votes. It's about actually just bringing it to a vote now and ensuring we have the political will to do it. And, I really advocate for that strategy of having New York lead the way and showing that it works, because single payer works. And then having the rest of the country follow along. But there are amazing organizers fighting every day to ensure that at the federal level we have enough legislators that are willing to push for it. And it really is an all hands on deck situation. And it's calls like these that help us share strategy and share tips and get a sense where people are. And it's really great to know that some of our Canadian friends are on this call, because I definitely look up to you, and not just because you're north of us, but because you passed it beforehand. And I want the same thing for my community, and I want the same thing for all of America.
Great, thanks so much, Jabari. I was holding on to a great question for you until you got here, so I'm gonna actually jump to that, since we were sort of in the middle of the Q&A, which is a question from Sammy, which is about if you could give your answer to people who argue that the US should really go for the public option instead of Medicare for all. And the public option, for the Canadians in the audience, is basically this idea that the way that we get to a Medicare for all system is basically by opening up the existing Medicare system in the US, which is for people 65 and older, or 67 and older now, I think, for 65 and for older Americans, by opening that up to people who want it. So, and basically that you create this option to opt into the public system and maintain the private system, with the idea that the lower overhead costs of Medicare would basically outcompete the private system and make it wither away. That's the argument. But what is your response to that we just should go straight to Medicare for all.
I mean, my response is that with things like these, you really need to ensure that everyone is participating in them and that everyone is contributing to them. And, you know, with things like a public option, we know exactly the people that will refuse to participate if we have it just be an option. We know it's the wealthiest people in America. We know it's the people that can afford, you know, Cadillac plans or their gold special, you know, triple plated plans. And we honestly need all people participating in it to ensure that it's robust, that it's well funded, and that everyone has buy-in to it, not just like with their money, but, you know, the political buy-in to say this is something that affects all of us, and therefore I'm going to contribute to it. So I don't think we should be setting up a two-tier system, because, you know, what we're saying in this is that healthcare is a right. You know, it's not a privilege that some have. It is not a special that some can get. It is a right, and you do that by ensuring that every single person is chipping into it.
Barry, can I just jump in on that for a moment?
Absolutely, go ahead.
I often say in Canada, so in Canada, we are the only country in the world that has a public healthcare system that does not have some form of pharmaceutical coverage. And one of the few benefits of being an international laggard in that response is that we can look to see what many, many other countries are doing. And it's sort of the same thing, I think, with the US's question that about, you know, whether they go to a single payer system or not, is there's plenty of examples. This is not just a theoretical issue. It's not an academic question. There's real data there. And the data is overwhelming that every health economist that came before our committee strongly recommends against any kind of private-public patchwork or a two-tier system. Not only for equity of access issues, but for plain old efficiency reasons. You need the economies of scale. You need to pool the entire population in order to get the savings, to realize the savings that makes the system. I mean, we keep coming back to this point. I know it's well known, but how is it that Canada can cover every single person in our country, and the US has? I know that Obamacare made some strides. I'm not as familiar with that program, but I know that has added many more Americans to get some coverage. But still, there are people not covered in the US. How is it that we can cover everybody and still have lower per capita healthcare costs? Well, it's because of those efficiencies that come by pooling everybody. And I'll give you one short little example. Right now in Quebec, the province of Quebec, they do have universal pharmacare coverage, but it's through a public-private patchwork. So they have a law that says that every employer must offer pharmaceutical coverage to their employees, and anybody who does not have it then is covered by the province, by the state. And Quebec has the highest per capita cost of pharmaceutical coverage in the country because of that. Because what happens is the most expensive cases are thrust upon the public system, and are cherry picked, and the least expensive, the cheapest covered people, who are generally healthy working people, are covered by the private system. So that's why there's data on this. It's not just a philosophical question. It's one of pure health economics.
Could I add one more thing?
Absolutely.
I just wanted to, one other reason to ensure that we have a system that is universal, that everyone is bought into, is that, you know, in the States and probably in Canada too, and in many countries, Republicans or right-wingers love to do this thing. Whenever we have a scenario where there is a sort of public-private setup, they love to do this thing where they de-invest from the public sector and, you know, kind of start to work to make it fail and use that as an excuse to more deeply invest in the private sector. And they do that with public housing. They do that with public education. They've done that with, you know, what public healthcare systems we've had, you know, consistently not defunding it, saying that it sucks, and then using it as an excuse to deregulate and privatize more. And, you know, having everyone bought into from the beginning into a fully public system with the abolition of private health insurance would be a bulwark against that.
Great. Thanks a lot, Jabari. Just another programming note. Since we got a bit of a late start, I know we're at noon Pacific, 3 Eastern. We're gonna push this another 15 minutes. So if you want to stick around, because there's still a lot of really interesting questions, and I haven't even begun to get to many of the questions that people have asked. One thing I think maybe this is a good question for Linda. I'd like to hear you talk about coalitions, right? So winning this fight for healthcare for all, for expanding coverages, we need people, we need to be working together. So I'd like you to talk a bit about what are the kinds of coalitions that need to be built to win this fight for healthcare justice.
Yes, hi, Jabari. Nice to meet you. And your dog in the back. It was interesting to see him or her. But the coalitions, it's similar to what the US is doing. We build a strong coalition of researchers, of people like you, Barry, that will study healthcare, that will study the cost, the pennies to death, and gave an argument to the politicians that it was not only efficient, it was the best thing to do. And with the research, we were able to convince groups like Heart and Stroke, like seniors groups, like anti-poverty groups, where it was, okay, it is evident, it is science that we need to have a national pharmacare program. And now, as I said earlier, we're working on revitalizing our long-term care, our seniors care. But you build a coalition with the research, you bring all the evidence you can. And I always say it takes more than a Linda Silas or a Don or a Peter to have a message. You have to have all the same conclusion coming from different voices. And research has probably been our biggest success. And then we build the group of workers. So in our country, we're unionized at around 28-30%, depending on the days. So it's quite high. And we have a very strong Canadian Labor Congress. But we had to come and say, okay, brothers and sisters, this is an important aspect for not only all Canadians, but for workers. As you heard Don mention earlier, when COVID hit and we had all these layoff of workers, they were caught without any plans. During the last year, we had double the numbers of workers that lost their plans compared to those who gained a health plan or a coverage for pharmacare for prescription drugs. So those were realities that we have to talk out in the open and build these coalitions of workers, researchers, advocacy groups, politicians. The politicians, it's every 4 years we have to start back, but it's okay. And it is quite important. And then attending sessions like this on a Saturday afternoon. It's to have, it's like the snowball effect. Now, Barry, you're from California. You probably don't know what the snowball effect is, but it starts very small and goes down the hill and it builds into a big, powerful snowball that you have to take into consideration. And that's what we're doing for Medicare for all, and that's what we're doing for pharmacare for all.
Just to be clear, I do split my time between LA and Montreal, so I'm quite familiar with sub-zero temperatures and snow. And I also grew up in Guelph, Ontario. So I spent most of my childhood making snow angels. Anyway, I actually have a question about it as someone whose research focuses and my, prior to being a sociologist, I was a union organizer. And when we're talking specifically about coalitions, there is one coalition partner that is actually really critical in all of this, whether we're talking the US and Canada, and that's labor. And I'd like to hear our panelists talk a bit about where they see labor fitting into the fight for healthcare for all, right? And I think that I know, and maybe Don could talk a bit more specifically about the history of labor's role in winning Medicare for all in Canada. I know that it was an important part of it. But I think, in the US, some unions are reticent to sign on to a Medicare for all program because they fear it's going to eliminate a key part of that union advantage right? So they see that the fact that they've got this great union healthcare plan sort of is a selling point, so to speak, for joining a union. And they worry that that's going to go away. And I think most recently, I think the most clear example of that was in Las Vegas during the Nevada primaries last year for the presidential election, when the culinary union, normally very progressive on a lot of issues, was attacking Bernie Sanders and Medicare for All on the rationale that it was going to undermine their ability to their healthcare plan that they have for casino and hotel workers on the Las Vegas Strip. So where does labor fit in more generally? And then I'd also, if the Canadians on the call would be wanting to talk about if they see some of that reticence about that union advantage when it comes to expanding, right? So whether the fact that union plans provide the kind of dental, medical, vision, pharmacare, that kind of stuff.
Well, sure. I'll jump in. It's great to see you, Jabari. Nice to meet you on the Zoom call. Thanks so much for being with us. The labor movement has been a key part of the fight for pharmacare in Canada. And I would suggest in the United States, there is a real advantage to having the labor movement being very supportive of Medicare for all, pharmacare for all, for the following reasons. Another aspect of universal healthcare and universal pharmacare is the competitive advantage that it gives to Canadian companies. So pharmacare is universal healthcare is about a $3,000 competitive advantage for each Canadian business vis-a-vis its American counterpart, because the company doesn't have to absorb the healthcare plan. Pharmacare is another $600 on top of that. So for the labor movement, for negotiating better collective agreements, having universal healthcare, having universal pharmacare means they can focus on things like the wage disparity that exists and really provide additional benefits to their members. So it's very much a no-brainer. And as Don has pointed out, we continue the fight for education, but it's better all around to have universal healthcare and universal pharmacare than it is to have the extraordinarily expensive, with the bloated profits that we see with these private-public patchworks that exist in the United States around healthcare and exist in Canada around pharmacare. And that's why the labor movement is so important to the success of getting healthcare for all in the US and pharmacare for all in Canada.
I might just add, and hi, Senator Brisport. It's great to see you. Prior to being elected in 2008, I worked for 16 years for a trade union, and it was the Teamsters Union, and we had a very big mixture of private and public sector workers. And I can say that, generally the ethos in the union movement on the ground is always that we realize that all workers always benefit from raising the floor for everybody. And frankly, it's one less thing to bargain, I think. So, and I can also say that as health critic, working very closely with the union movement, and I'll leave it to Linda, who has served on the Canadian Labour Congress executive for many years, that they've been critical supporters. So the labor movement in this country, my experience has been, they are always very strong supporters and proponents of expanded healthcare coverage. I have not heard any union in this country who has articulated the kind of concern, Barry, that you mentioned, so the culinary workers and that you pointed out. I have not heard that here. On the contrary, the CLC has been a driving force in this country for public pharmacare.
Yeah, and if I can add it, but again, it's about education, Barry. We have to give the dollars and cents. I've been at many bargaining tables, and I've rarely met an employer that just wants to give you more money, give you more benefits. For Canada, our health plan that covers our prescription drugs, so about 60% of unionized workers have a health plan. It's about 12% of salary. So imagine if that 12% would be a salary increase. So as Don and Peter said, we'd just be lifting everyone up. No, we're giving that 12% to insurance companies. And my message to insurance companies is don't worry. There'll be a life for you for other kinds of benefits. It won't be difficult to negotiate something else. But for the basic of what we need and for the efficiency of our system and our collective bargaining process is we need to have all a basic of healthcare, a basic of pharmaceutical, and then my list could go on. But it's really showing negotiators, here's the dollars and cents. 12% you could be putting in salaries. You're putting into a health plan just for prescription drugs. And that is where the highest increase. I have a small staff team in Ottawa. Every year, the insurance company, it goes up. And so you have to cut the benefits because of the cost. So we need to better look at the how it works.
Jabari, do you have something to say about the U.S. context?
I mean, strategically, not much more to add than, what some of, my comrades on the call have said about, it just works better for there to be no carve outs. I mean, I can speak to New York specifically, how even, in New York for the New York Health Act, there's been a couple unions that have pushed back for the reasons that were said earlier. They don't want to lose the healthcare they currently have. They wouldn't lose healthcare, but they perceive it as losing healthcare. They've asked for and thankfully the person, again, his name is Senator Gustavo Rivera, who's sponsoring it in the New York State Senate, has been pushing back for the same reason that we said earlier about not having a two-tiered system of public and private. These things have to be all of us in, or else they don't work the way they're supposed to. So I know a lot of advocates have been speaking with labor activists and trying to get them more on board. It is a conversation that needs to be had, but we have to operate continually from a place of saying, this is Medicare for all. It's healthcare for all. Okay, it's all of us in, nobody left behind.
Great, that's a great message. So we are sort of running short on time here. I'm really sorry. There's a lot of great questions here in the Q&A that we could easily spend I'd love to spend another hour talking with this panel because there's such great ideas here and more great questions to ask. But I do want to give an opportunity to people to talk about sort of the concrete actions we can take, right? So we've discussed some of the challenges, we've discussed the obstacles, we've discussed who the key coalition partners are. Let's spend the last couple of minutes here talking about what we can do in the US, in Canada, for winning this fight that really needs to be won. So I know some of the DSA people had something to say, but maybe if the Canadians maybe have something to say about what can be done in Canada, what are some concrete steps we can be talking about right now for people on the call? Let's start with that, just very briefly.
I'll go quickly. It's tell your stories. We have to hear more about the human stories, about the children going without their asthma medication, about the grandparents going without their high blood pressure medication or splitting their pills in two. We have to hear more about the human stories. And that's what will change public perception, but also change, I can't even imagine some unions are against Medicare for all. I'll go and talk to them myself, but really you can't be a union activist and not believe in human rights. And you can't be a union activist and not believe that healthcare is a human right.
Okay. Peter, did you want to add something since you were talking about the current struggle?
Well, absolutely. And I think the need has never been greater, as we've seen through the pandemic, but popular support in Canada and the United States has never been greater. And I think this is the key, that we continue to tell those stories. As Linda's pointed out, we need to make sure that people are aware of the enormous costs of the for-profit driven systems that we have right now that simply are not in the interests of people. And on my website, peterjulian.ca. I know Don will want to talk about his website, dondavies.ca. You've got some calls to action that you can follow up on if you're interested in learning more about our pushback in Canada. And I love the closer collaboration between democratic socialists in America and democratic socialists in Canada. We need to work together because the more we work together, the stronger we are. And thanks so much for the DSA for having sponsored this important forum today.
Great. Don, did you want to add something?
Well, I don't think I can say it any better than Linda and Peter just did. I mean, I do think there's massive public support for this. You know, I have two thoughts. One is we just have to elect politicians who are going to do it. I mean, and we got to organize. We have to make this a priority. I want to say, I also think, I always think of the way that we got Medicare in Canada, how it started in Saskatchewan. And I'm even wondering if strategically, I was thinking the US, if they could get single payer established in one state, I think the model would grow like a wildfire across the United States, because it'll burst all of the mythology, you know, like these myths that public, I know this is very common in the States, that public coverage means poor quality care. That's nonsense. We have extremely high quality care here in Canada, but there's these myths that are created in the US. So I think that, you know, part of it, I wonder if that we shouldn't just get everybody marshaling our resources to get it established in one progressive state in the US. And then as a, you know, what's the old thing? Don't tell me, show me, might be a model. But other than that, we got to elect politicians who believe that, as Linda said, healthcare is a fundamental human right. It shouldn't be a privilege depending on the size of your bank account.
Great, thanks so much, Don. So related to that, I did mention if there are people on this call from California, there is an effort currently underway to build sort of Medicare for all in California. I know Jabari has been involved with a similar effort in New York. So why don't you talk a bit?
You just made it a race. Now it's just a race between New York and California. Just call for competition.
We're gonna revive the East Coast West Coast rivalry, but to better gains perhaps than in the 90s. So let's so Jabari, can you just take it home for us to talk about the U.S. concrete steps? I did mention that, you know, if you want to get involved, there is the Medicare for All campaign in California. There's and you can maybe talk about New York and just more broadly, like concrete actions that people can take who are on this call who want to build the fight for Medicare for All.
Absolutely. So again, you heard the two states, California and New York. In New York, it's called the New York Health Act. So you can even look up, you know, and see if your state legislator is signed on to it. And I will, this place where I will just defer to DSA, which is doing just incredible work in my state and just nationwide for the fight for Medicare for all. We have healthcare working groups at the federal level, at local levels fighting for this. So I don't have the link on me. I hope, you know, somebody else posted in the chat or everyone. You should definitely sign up for the work that DSA is doing and plug in and join in. And yeah, we'll take it from there.
Okay, and the link is, oh, sorry, I'm going to drop the link right now. If you'll hold on. Oh, great. It's not letting me cut and paste. Okay, just go there. Oh, whoops, sorry. Anyway, medicareforall.dsausa.org is the link. I just sent it to panelists. Anyway, so that is what we have time for today. Thank you so much to all the panelists. This is being recorded, so it will be available, I believe, on the Facebook event page later on. But again, I'm sorry I didn't get a chance to get to all the great questions, but I will say that I really appreciate all of you taking the time to speak with us today. Thank the attendees for being here, and you know, just keep up the fight. So this is something we got to win healthcare for all. So thanks, everyone.